Welcome to this explainer from the Medicine Diary. Today, we're diving into the daily realities of taking Lipitor, one of the absolute most prescribed medications in the US. If you've ever held that little pill in your hand and thought, what is this actually doing inside my body? Well, you're in exactly the right place. We're going to break down the complex medical data into crystal clear, actionable facts. Let's get into it.
Millions of Americans rely on this exact medication, generically known as Atorvastatin, to protect their hearts. But, it's completely normal to wonder if the long-term risks are actually worth the daily commitment. There's a lot of noise out there, so we really need to bypass the hype and unpack the actual science from trusted sources like the FDA, Harvard Health, and the NHS.
So here are the 5 key takeaways we'll be covering today. We're looking at how this drug actually clears your arteries, why your morning grapefruit could actually be dangerous, how to weigh the diabetes risks against the massive heart benefits, when to take muscle pain seriously, and finally, why quitting cold turkey is a terrible idea.
Here's our roadmap for this explainer. Understanding statins, the grapefruit effect, side effects and diabetes, dealing with muscle pain, and safely stopping.
All right, Section 1, Understanding Lipitor and Statins.
First off, we need to understand exactly what this medication does once it's inside your body. It's not just some magic pill, right? It's a highly targeted biological tool. By definition, Lipitor is a statin. Statins are lipid-regulating medicines prescribed to lower your bad cholesterol and triglycerides. Doctors usually prescribe these when diet and exercise just haven't been quite enough to get your numbers into a safe zone, making this an incredible tool to reduce your risk of a heart attack or stroke.
And the way statins work relies on this brilliant twofold mechanism. First, they act like a roadblock in your liver, literally stopping the production of new cholesterol. But they don't stop there. Second, they actually help your body reabsorb the cholesterol that has already formed those dangerous plaques in your artery walls. It's kind of like a cleanup crew for your blood vessels.
Moving on to Section 2, the grapefruit juice effect.
Now let's talk about a very famous dietary restriction that honestly confuses a lot of patients. Why does a healthy fruit suddenly become a hazard? Well, normally, an enzyme in your intestine called CYP3A4 safely breaks down Atorvastatin. But grapefruit contains compounds called furanocoumarins that block this exact enzyme. Without that enzyme doing its job, the drug doesn't break down. Instead, it builds up to toxic levels in your bloodstream, which drastically increases your risk of severe side effects.
But hey, don't panic. If you absolutely cannot give up your morning grapefruit juice, you are definitely not out of options. Just talk to your doctor about switching to an alternative statin, like Crestor, Provichol, or Livalo. Since these specific drugs aren't primarily broken down by that same enzyme, they safely bypass the grapefruit effect entirely. Pretty neat, right?
Section 3, Side Effects and Diabetes. We really have to address one of the most talked about concerns out there. The official FDA warnings regarding side effects and the potential risk of developing type 2 diabetes while taking Lipitor. The crucial point here is that we have to look at the big picture. Yes, the FDA notes there is a small increased risk of elevated blood sugar levels, but, and this is a big but, they explicitly state that the heart-protecting benefits drastically outweigh that slight risk. You're getting a massive reduction in life-threatening heart attacks and strokes. It's all about protecting your most vital organ first.
However, it's absolutely essential to know your own personal risk profile. If you fall into any of these specific categories, like being over 45, managing obesity, or having existing liver or kidney issues, you are at a slightly higher risk for those blood sugar changes. That just means you and your doctor need to work closely together to monitor your blood sugar regularly while you're on the treatment.
All right, Section 4, Dealing with Muscle Pain. This brings us to probably the most common patient fear, and honestly the #1 reason people hesitate to take their medication: severe muscle pain. Looking directly at the official patient leaflet for Lipitor, we see stark, serious warnings about muscle-related side effects. While mild aches can be common, there are specific, severe symptoms that you should never just try to tough out.
Check out this quote from the medical literature. It highlights a rare but life-threatening condition called rhabdomyolysis. When abnormal muscle breakdown happens, extensive muscle damage actually releases chemicals directly into your blood. If that's left unchecked, it can overwhelm your system and literally lead to permanent kidney failure.
Because of this, you really need to know the warning signs. Contact a doctor immediately if you experience constant, unexplained muscle weakness, profound fatigue, or if you notice your urine turning a red, brown, or tea-like color.
Similarly, jaundice or unexpected bruising are massive red flags. Do not wait for your next checkup if any of these occur.
Which brings us to Section 5, safely stopping your medication.
So, what happens if the side effects just become too much? Or maybe your lifestyle changes worked wonders and you want to stop taking your medication? Listen, perhaps the most important takeaway from this entire explainer is this warning right here. Never quit cold turkey. A major 2016 research review showed that stopping statins abruptly can literally double your risk of suffering a cardiovascular event. Your body has adjusted to this support, and just ripping it away causes a dangerous rebound in your cholesterol levels.
Instead of quitting on your own, please work with your doctor on a safe, step-by-step exit strategy. This could mean switching to a non-statin medication like ezetimibe, adopting a much stricter diet, or simply lowering your current dose while adding a supplement like CoQ10. Some studies actually suggest CoQ10 can help ease those frustrating muscle aches.
Finally, critical analysis and audience takeaways.
As a premium healthcare awareness platform, we always want to leave you with a critical, objective analysis of the facts, separating the hype from the actual science. This cable perfectly breaks down the medical truths versus the myths. It's highly accurate that grapefruit causes a toxic buildup, but context matters. While the diabetes risk is real, the American Diabetes Association still recommends statins for most diabetics over 40 to protect their hearts. And importantly, statins don't magically cause weight gain. Studies show patients often just eat more calories because they feel protected by the pill.
To empower you on your own health journey, here are 3 highly actionable tips you can apply right now. First, limit your grapefruit juice to just 1 or 2 small glasses a day. Second, stay vigilant with your blood sugar monitoring if you're over 45. And third, always advocate for yourself. Never suffer in silence if your muscles are screaming at you. I want to leave you with this final thought to ponder today. When you weigh the life-saving benefits against the necessary lifestyle tweaks, are the heart-protecting benefits of statins worth the daily adjustments for you? Medicine is deeply personal, and informed decisions are always your best defense.
Thanks so much for joining us for this explainer. Taking control of your health really does start with understanding it. Please subscribe, visit us at themedicinediary.com for more premium healthcare awareness content, and definitely drop a comment below. We would absolutely love to hear about your own experiences navigating statins. Stay healthy, and we'll see you next time.